Hi, everyone. Today we have a very interesting topic ahead of us and a really special guest. We have Kevin Durjun, who's a communications lead in the European Traditional Chinese Medicine Association, and who is also an acupuncturist in the Five Elements acupuncture with a background in psychology. And he is someone who specializes in mental health in his practice as an acupuncturist, and he's based in London in the UK. So welcome to Dr. the podcast, Kevin.
Well, thank you. Thank you so much for having me. I'm so excited about this conversation today. We've got a lot to talk about.
Yep. Definitely, Kevin, and welcome. So as we are in the month of November and also the movement of Movember, we would like to speak about mental health with you. And to start off the topic, because we've been speaking to the men around us, and the first thing that comes up is mental health. When it's like, if you were to have somebody speak about a topic about mental health, men's health, what would it be? Mm-hmm. Everyone said mental health. Mm-hmm. So we came across this striking kind of stat around that based on the Mental Health Organization in the UK. It says that in the UK, men are 3 times more likely to take their own lives than women. And on average, 12 men in Britain take their lives every day. So suicide is the single biggest killer of men under 45. Yet it's not just young men that are at risk, as the highest suicide rate is for men is between the age of 45 and 49 in the UK. So I'm sure there are many factors that kind of involve suicidal rates, but we want to potentially gear it towards mental health. And as someone with a background in experimental psychology, what is your take on this?
I think that it is huge, absolutely huge. I think that it starts off when we are little boys. We're told big boys don't cry, aren't we? We're told that. We're told man up, pull yourself together. So from a very, very young age, our parents are reminding us that we're supposed to be the strong ones. We're supposed to be the ones who look after our families, look after our younger siblings. We're supposed to be the grown-ups, even from a very, very young age. And that's a huge amount of pressure that we put upon our young men as they grow up. So it's no surprise really to me that as we grow up, we begin to lose connection with our emotions, and we lose our ability to express our emotions. If we've suppressed things for a long time, sadly they come out in very warped and unhappy ways, as shown perhaps by all of these terrible statistics that you're talking about.
Mm-hmm. Yeah. And as an acupuncturist, what would you say is your observation about this, about mental health?
Okay, I think that mental health is many of my patients come to see me because they feel low, they feel depressed, they feel anxious, particularly after the C word, the COVID pandemic, where so many people have been left alone, they've been isolated. Many of my patients are young men, they live in flats by themselves, they weren't able to see anybody. And as the lockdown began to be released and people began to be allowed to see people again, a lot of those anxieties have remained. As an acupuncture practitioner, I'm very aware that there is a lot of research that demonstrates how effective acupuncture is at helping people with anxiety, helping with depression, helping even with post-traumatic stress disorder. And the really interesting thing for me as an acupuncture practitioner, and also having trained initially in experimental psychology, is that we approach things in very, very different ways. So when I was doing my training at the University of Sussex all those years ago, it was fascinating, absolutely fascinating. I loved hearing about all of the research, all of the studies into mental health, into mental disorders. And I learned about, schizophrenia, paranoid schizophrenia. I learned about depression, anxiety disorders, post-traumatic stress disorders. And also I learned that there is very, very little that can really help people long term or cure these conditions long term. One of the other issues that came to me, and even when I was an undergraduate studying this brilliant science, was that there's an awful lot of labeling that goes on. We're labeled as being paranoid schizophrenic, and something really interesting happens when you tell somebody, I've diagnosed you, me in my white coat, clever, Western medical person, I can tell you that you've got this particular condition, you've got depression. Something really interesting happens. And this is again, a scientifically proven fact that people begin to exhibit more of these symptoms. If you tell somebody that they have paranoid schizophrenia, well, I mean, nowadays we've got this wonderful friend or fake friend called the internet. We can Google that. We can find out all about the symptoms, and all of a sudden these symptoms can become worse. And in many patients, it does become worse. And what I really love about acupuncture, and one of the reasons why I jumped ship from the science world to the complementary medicine world and integrated medicine world, is that we don't do that sort of labeling. We look at our patients in a very different way, and we're able to help our patients by using different modalities to help and to support them.
Interesting that you're saying that, because when you were talking about post-traumatic stress and disorders and having acupuncture being a solution for it, you might not even, think how is that even linked? I see your face. Tell us.
I am so happy to talk about this. So I can talk about two wonderful things that have happened recently. So in the UK, a wonderful acupuncturist called Naji Malik, he has run a brilliant project with his local community. And he worked with veterans, so people who have seen warfare. And you can imagine, you see something terrible in a war zone. We used to call it shell shock, where people came back, they were withdrawn, they had night sweats, they had terrors, they weren't able to verbalize what they'd seen. T.S. Eliot wrote, sorry to get a bit arty here, but T.S. Eliot wrote a beautiful comment in one of his books, which was, "For mankind cannot bear so much reality. For mankind cannot bear so much reality." And this is, when you see war, when you see people killed, when you experience those awful conditions, we're not meant to, as human beings, supposed to be seeing these terrible things. Is there any wonder that our ability to cope absolutely diminishes? This wonderful acupuncture practitioner called Naji Malik, he did a brilliant study with some veterans, where he gave a very, very simple and very well-known acupuncture protocol to these former veterans, men and women. And the results were absolutely outstanding. Absolutely outstanding. This is a very ancient sort of treatment where you use, I'm just counting them now, 1, 2, 3, 4, 5, 6, 7 points on the body. And these points, these acupuncture points used together, it's essentially has the effect of unlocking something within the body. Let's call it energy. It has this effect of unlocking the energy within the body. The amazing statistics were, I think it was something like 80% after a course of acupuncture, 80% of these ex-service people, they no longer reported having post-traumatic disorder.
Wow, that's powerful.
This absolutely powerful work. And in the US, where they have a huge provision of healthcare for their veterans, recently in the US, they've been spending millions of pounds investigating the efficacy of acupuncture treatment to help their ex-service people. And acupuncture is now available. It is classified as a valid treatment choice for post-traumatic stress disorder, which incorporates depression, anxiety, night sweats, insomnia. So many of the conditions that so many people experience every single day.
I think the question is, when we think about mental health, usually we think about talking therapy and going to speak to your psychologist. So what happens usually in a room with a psychologist? What it is and what it is about that men don't like?
Okay, well, I can give you a couple of 4 examples from my clinic. So I'm thinking of two men at the moment. So one of them, a gentleman in his 30s, and he'd experienced some very stressful period at work, and he was signed off sick. And he was prescribed by his doctor, before they went down the chemical route of antidepressants and anti-anxiety medication, he was prescribed a course of talking therapy, which was 6-hour-long sessions. I think they were 50 minutes to an hour-long sessions with a counsellor. And he found that these were quite difficult for him. Because he wasn't entirely sure what he was feeling so anxious about. He didn't really understand the genesis of where of where his problems came from. And he was prompted to sort of go down various routes. And he was thinking, actually, I don't think that these issues started in my childhood. I don't think that they started somewhere else. But there was something about the interaction that didn't work for him. Now, I'm certainly not saying that there isn't a role for talking cures, because there is. There absolutely is. And opening up and talking with people can be one of the most profoundly life-changing experiences that they have. So I can absolutely see that this works for many, many millions of people, and it's entirely helpful. However, for this particular patient, it didn't work. And he was left at the end of the 6-week period still feeling as anxious and as low as he had felt at the beginning of the sessions.
I read in the mental health org that's in the UK, and they were saying that about 36% of men like actually use the talking therapies that are recommended by the NHS compared to women. So it kind of shows that maybe it's not exactly the best model or mode for getting therapy or assistance, right, for mental health for men particularly, right?
Well, I know that there are some acupuncture practitioners who also do a lot of group work with their male patients, and they receive a huge amount of benefit from this. However, nothing works for everybody. Nothing works for everybody. For sure. And I suppose where I'm coming from at the moment is for some men who aren't able to be helped through talking conversations or talking therapies or unburdening, sometimes perhaps we need to look at things in different ways. If we're talking about blokes who don't really open up, who don't open up to their wives, girlfriends, partners, whoever, why are we trying to push them to talk? Yeah. Perhaps there is a different way. And for me, this is where a treatment like acupuncture comes in, or can come in. One of my wonderful colleagues, Rachel Peckham, she heads up an organization called the National Acupuncture Detox Association, or NADA to its friends. And this is an ear acupuncture association where they work with hundreds and hundreds of thousands of people all around the world, helping people who have anxiety, who have mental health issues, who have issues with drug and alcohol abuse. And the way that the NADA protocol works is people will come together in a room and they will sit down together quietly. And they'll be in a circle, or if there aren't many of them, they'll just be there in a line, and they will sit and they will receive the treatment, and they'll receive a benefit by being with other people and sharing and being part of a shared, perhaps meditative space, although we won't use the word meditative if we're talking about people who don't get this sort of stuff. Yeah. Right. So we don't need to use words like this. And I wanted to mention a little bit about some of their work that they did recently. There was a terrible fire in West London a few years ago, the Grenfell Tower tragedy, where so many people died. It was a huge tower block that went up, and many people died and lost their lives. And the people of that community in West London were absolutely traumatized. This is men and women and children. They were absolutely traumatized. And my colleagues set up a terrific project where they did some ear acupuncture work. They set it up in a local mosque. So they were working directly with people. One room was for men, one room was for women. And I went along and I did an interview with some of the people who'd actually been there. Right. And they were talking about their anxiety levels decreasing. They were talking about their stress levels decreasing. I mean, they were even talking, and my lower back pain went as well. These things are great outcomes, which I suppose demonstrates that there is a place for talking therapies. Of course there is. But also there is a place for non-verbal therapies. Yeah. Treatments like acupuncture, treatments where we're in connection with people, but also we are connecting within ourselves.
For sure. And I think it's a good thing that you really highlighted it, because I don't think many people, especially men, I don't think, as you said, they may not like to talk, that's one, but many times they may not even know or have the awareness that they have a mental health issue that's happening. And it might actually be manifesting, or maybe it's they come with a different problem. And as you said, some of the people who suffered or were part of the building that experienced the fire, they said their lower back pain disappeared. Would they have ever known the connection?
Right. So do you see this in your practice when men come to see you and they come with the presenting issues, which is, a back pain, but deep down there are other ailment that is going on?
Every day.
Yeah.
Every day. Every day. So, for example, I had recently I had one wonderful man. He was a train driver, and he came to see me. He had exceptional lower back pain, and we got to the end of the, I'm going like this for a reason. I'm not just doing it for fun.
He's hopping.
I was like, are you in the exercise ball?
He came to see me because he was a train driver, and one of the key problems for train drivers is that they're in a train for hours and hours and hours every day, and the vibrations from the train leads to severe lower back pain and sciatic pain that radiates down the leg. And we were able to talk about this and discuss, so the vibrations are never going to go away, but you can take control of the situation by perhaps reducing the number of hours that you work and making that decision to take control of your life. And this is something, I mean, it was great. His back pain got sorted out in a couple of treatments, but equally, it's not going to return because he's taken control of his life by making changes to the point that was aggravating the issue. So by reducing the number of hours that he's working, he's no longer having this strain.
How does acupuncture help enable the client to open up to you? Because I'm sure that as they arrive to you, they were not going to tell you like, I have panic attacks because of XYZ.
It takes time, and it takes building up trust and creating a rapport with your patient. It's really important that when somebody comes to see you for something, that you help them for that something. So if, for example, somebody says, right, can you come and help me for my panic or for my knee pain, for example, that we actually bother to take a look at the knee. We look and we see what's going on, and we take an interest. In that way, we start to open up the channels of communication. Somebody's coming to me with a problem, I can then help them with that particular problem. The acupuncture points themselves are really helpful. So just as I mentioned earlier on with that sequence of acupuncture points used for post-traumatic stress disorder, that process alone opens people up. It makes people feel brighter. It makes people feel much more positive. When people feel more positive, again, that trust is built up. So there is something in it, because there's an awful lot of doubt about whether acupuncture works, whether or not it is just, placebo. It isn't, by the way, but
yeah, no, because we're having those conversations because of that, right? Where people go for acupuncture because they believe that, they don't see acupuncture as a healing system or a modality that can help them recover. And it's usually seen as mostly like a spa or like a Groupon type of thing.
Oh God. Now, I have nothing against my very, very highly qualified acupuncture practitioner colleagues who introduce people to acupuncture through whatever offers. It's worth pointing out, from my perspective, that in order to really give enough benefits to your patients, that you need to know what you're doing. That takes at least 3 years of studying, to a degree level, which means that then you can truly grasp the huge complexity of what acupuncture can do for patients. So that's the first point. If we're looking at men and Groupons, so often, and I've done these in the past, but always the images that are used, well, 99%, there'll be an image of a woman looking at, maybe with a lovely flower in her hair, looking so relaxed. And
let me tell you that's not true, because I've done a treatment and it's not that relaxing.
Yeah, and I mean, I certainly don't tuck flowers in, behind the ears of my patients, but it is.
You don't? Why?
Do you have the spa music on?
Well, I know many people do. I don't, because the way that I treat patients is it's a medical process. This is a medical system. We're using different techniques to find out what's going on within the person, but it isn't just a relaxing treat. It can be profoundly relaxing, but also it does have huge benefits to mental, physical, emotional health, and lasting benefits. And we need to always remember that it isn't just a lovely add-on to have, because it makes you feel really relaxed and pretty. I also think that a lot of these images can prevent men from coming forward to accessing these sorts of services, because there is a very big perception that acupuncture is just a spa treatment, which it certainly isn't. It is a wonderful treatment that's been around for over 2,000 years. It's got a vast number of people who use it. There's a vast and growing body of research evidence to demonstrate how effective it is at supporting so many people with a wide range of very serious conditions.
Yeah, and I'm just curious, like, so as you were saying, and earlier Guni was mentioning as well, like for acupuncture and for mental health, right? For men who come in and they're not really sure what's happening, but like what is the impact when you press these needles into their body, right?
Yeah.
What is triggered, and what is kind of the process that they start experiencing that shifts this their experience or their symptoms of mental health?
Okay. There are a vast number of theories about how acupuncture works, but one beautiful, beautiful theory is that the acupuncture point, the needle stimulates the acupuncture point. This then releases a series of chemicals which go up to the brain. Every time one of these signals reaches the brain, it's amplified. And this has a wonderful pain relieving effect throughout the body. It's like a cascade effect. One acupuncture point leads to a cascade of beneficial effects. And this has been shown with people a lot cleverer than I am who've done research into this. They've looked and they've seen that areas of the brain actually are activated when you stimulate an acupuncture point.
Yeah. And with my little knowledge of Chinese medicine and just kind of like the links with, you know, the different emotions with different parts of the body, is there a trend that you see with your male patients when they come in? Of course, they come in with like maybe we label them as anxiety or PTSD or depression, right? But is it often linked to a certain type of organ and related to a certain type of emotion?
Okay. So I can give you a very, very quick class in acupuncture and the organs around the body. So there are 12 organs in the body, 12 organs, and we can access them as an acupuncture practitioner through many, many, many years of study. We can access them by feeling the pulses on the wrists. There are 6 pulses on each side. Now, when I started to do acupuncture, bearing in mind I'd come from a science background, when I was taught, right, you can feel energy flowing through the wrists of somebody's body, the scientific part of my brain said, rubbish, absolute rubbish, because who can do that? Well, now I'm so delighted and so blessed to say that I can. I can feel what's going on inside my patient's body by reading and diagnosing what's going on through the wrists. Just like a nurse can feel the wrist, and she can feel, or he can feel, what's going on with the heart rate. We can feel these things. But this is just a slightly more subtle way of doing it.
Right. So I was going to say, for those skepticals out there who's going to hear this, like I can feel, they might be saying, again, this is rubbish. So what is it exactly that you can feel with regards to that specific organ or the blood flow? What is it that you can sense through the pulse?
Okay, I can sense if there is something going really badly wrong. So I can sense if energy isn't flowing from one set of acupuncture meridians, which is a set of acupuncture points, a little bit like a train line. I can sense if there's a blockage at the end of one line and the beginning of the next line. And very often this will be accompanied, the patient may well say, Kevin, I've got a really bad stomach ache, or I'm having loads of diarrhea, for example. I will feel on the pulse, actually, there's something corresponding to your large intestine and there's something corresponding to your stomach meridian. These go hand in hand. By unblocking those, my patient is able to come back to me the next week and say, well, actually, I feel so much better. And I don't have these symptoms anymore. So there are 12 different organs which are associated with 5 different elements. So you can see a lack of fire in a patient. They may well come to you, their face is completely grey. They might feel miserable. They can't see any joy in anything. You know, if we imagine on a beautiful summer's day, we're out celebrating with our friends, we're in the park, you know, love is in the air, we're all having summer romances. That's the energy of summertime. If you don't have any of that joy within you because you partied too hard, you've burnt the candle out at both ends, there's no joy left in you. It's up to me as an acupuncturist to lift up those levels of fire.
So how would the lack of fire be translated in the pulse? Okay, so I can see that you can see them being physically down, etc. But say you couldn't notice them. Would you be able to pick it up on the pulse?
You won't feel it. It'll feel like it isn't there. It'll feel like it
Right.
isn't there. And by using acupuncture points to stimulate points relating to the fire meridians, we're able to lift up that pulse, and we're able to make somebody begin to feel a tiny bit of joy. And with treatment, they begin to feel happier and more joyous. Many people suffer with anxiety, thoughts that go round and around and around and around and around. That can often be associated with the next element along, which is earth element. That's things being processed, not being able to get rid of this anxiety. The next element along is the element of metal, which is associated with the season of autumn, where the leaves are falling down and we're feeling sadness, that time is passing, loss, grief. And often people can come and they feel absolute grief. The next season along is can often relate to fear and panic. That's the season of winter. We're all terrified. We're all terrified in wintertime. We don't know what's going on. Is this winter ever going to end? Often we feel a bit nervous. We put aside all of our reserves of food for during the whole summertime so that we can just get through the wintertime. If there's an imbalance within the organs of the body associated with water element, which are the kidney and the bladder, we can feel terrible panic, real fear and upset. And the final point along this wonderful circle, which just corresponds to the natural cycle of life, spring, summer, autumn, winter, it just goes around and around, doesn't it? The last one is springtime, which is optimism. Imagine if you've got no hope at all. Imagine if you're completely hopeless. If you've got none of that sense of springtime and the optimism that comes, this can make us feel terrible. So there are so many different ways that our mental health can be affected, because any one or combination of all of these parts could be going wrong. And by reading somebody's pulse, by feeling how they are in the treatment room, we're able to really we're able to make a very big difference and profound difference to their lives, one that is long lasting.
Yeah, that's a good point to highlight, and also gives context to people, helps them see that they're not just, it's not just like, this is them, like their mental health issue is everything about them, right? So it kind of gives them a nice breakdown of how they can address one part of it versus the other.
Yeah, and to be honest, like, we are currently in November, so it's autumn, and I experience exactly what are some of the things you were saying, where it's fall, everything's going down, and there's a feeling of sadness. And so knowing that these external elements can impact your mental health, and it's not necessarily, it's an environmental factor, right? And then you also have your own things that you're dealing with. Sometimes it's hard to be able to own it completely and feel completely, I've got this, and nothing's affecting me. So being aware that it happens and it's okay, and we all should, we all experiencing this sometimes in the same time. And so being open about it and being able to talk about it, or having someone help you enable that awareness of saying, okay, I feel this, and I want to be able to open up, is quite powerful.
Well, there is a very, very well-known phenomenon, seasonal affective disorder. Everybody knows about this. It's the light levels are low. We do feel a lot more depressed at this time of year. But with acupuncture treatment, I will often recommend to patients, if they're coming to see me because their fire is really flat, I might encourage them, right, let's actually now have a look at your friendship groups. Do you have enough people who you can confide in, who you can talk to? Are you members of enough societies, for example? Are you doing things that cultivate that sense of joy within you?
Right.
So let's talk about incorporating more fun, being silly, because all of those things are important. And this again is for me a very important point to make, that health and well-being, it doesn't just mean sitting and lying on a couch and somebody telling you what to do. It also takes, you need to do something, and you are empowered to take control of your life. No amount of needles, just like no amount of tablets, is going to make you feel great if the rest of your life you're sitting on the sofa eating bags of crisps, not talking to anyone. We need to incorporate and to live lives, and to really, really enjoy our lives as well. But that will be different for different people.
You're right. And I think you're highlighting, like, because we always reference back to like WHO's definition of what health is, right? And it's incorporating mental health, physical health, spiritual health, and social health. So social health is an important factor. So like, in this sort of season where you're going into winter, you naturally will go out lesser. And plus we are like still somewhat in a pandemic, right? So navigating that as well is tricky. So then living in this environment, you have to be kind of aware or improve your awareness to know like, okay, these factors might affect my health and my mental health. So what can I do to like negate the experience that might happen if I don't address these factors, right? Which actually ties really well into like what I was going to ask you next is like, what can men, particularly because it's Movember and it's harder for them to open up, what can they do today and right now to kind of help bridge that gap, to help them open up a little bit and bring some opportunity for them to express themselves?
Okay, I am a great advocate of expressing yourself and just trying any old thing. I think that is really, really important. For a while, I myself, before the pandemic, I felt a little bit unfulfilled, and I didn't feel that I was getting enough attention. I didn't feel as if I was visible enough. And that was after a bit of reflection. And as a result of that, I decided that I needed to be heard a bit more because being heard is important to me. And I was wondering, how on earth do I do this? And I tried various things. And eventually I decided that I would connect with UK Health Radio, and I started to present my weekly show. Yeah. That gave me the outlet, the creative outlet that I needed in order to feel I was being heard, I was connecting with people. And that's got nothing to do with medicine, but I tell you something, it made me feel so much better about myself. Really, really interesting. It doesn't have to be, okay, now we need you to go to the gym. Not at all. Health isn't just about this.
It's like an indicator, right? It's so you feel low about yourself. And I think that's what the difference where suppressing it versus listening to what is this signal telling you. And you chose to say, okay, why do I feel this way? Oh, I feel like I need attention. I need to be heard. And then from there, you took a solution. You decided for yourself that I'm going to do something about it. But I think that the interesting point is that it arose in a negative way. It was a bit painful, but from that, you took it to a positive space.
Yeah, exactly. I think that this is, the first answer is for men to feel where they're feeling unhappy, where just take some time to feel what's going on inside your body, just to be a little bit quiet, to be a little bit within yourself. And if that's a bit painful, well, don't do it for too long. Just make a little bit of time. One lovely description of acupuncture is that life can be very, very tough. And sometimes with an acupuncture treatment, it provides just a tiny beam of light into the body, so that even if you're feeling better for the duration of the acupuncture treatment, this is an indication to yourself that you don't always need to be feeling bad, that it is possible for you to reach a different state. Right. Mm-hmm. So just to feel where you're not feeling right, just to feel that, mm-hmm. and just to know that that's fine. Yeah. That's just getting in touch with yourself. Just getting in touch with yourself, I think, is one of the most important things to do. Okay. The second area that I think is really, really important is to take time to breathe. Mm. So I have a wonderful, wonderful patient who has come to me for bipolar disorder. Mm. And he came to see me right at the very beginning of what he thought was going to become an episode. He'd been having episodes for many, many years. And one of the techniques that we discussed was, it wasn't all that miraculous. It was just, when you're feeling a bit anxious and you're feeling everything's beating away so quickly, let's use that understanding of, we've felt how things are within the body. First step, I feel the anxiety, I feel the adrenaline beating up here, and let's bring it all down. Let's use our stomachs. Let's use our abdomens. This is one time where it's great to not have a six-pack. Let's breathe.
Good message.
Yeah. And actually in Chinese medicine, this area needs to be lovely and soft. So, according to Chinese medicine, I'm healthy. So,
I'll be riding on that bandwagon with you.
So let's feel our issues up here or wherever they are, and let's bring them down to our wonderful core. Let's bring them down to our diaphragm, and to spend time just breathing in and out and slowing things down. So that's the second key, I think, to helping yourself, just being aware and breathing, just connecting yourself to your breath. And the final suggestion I think is really valid is to take action. If to look at what's feeling unhappy in your life, or to be aware of what's feeling a bit crunchy. You know, when you're driving along the motorway and you go because you're a little bit close to the edge. Okay, that's a sign that something isn't quite right. Listen to that. That's a good thing. If you're feeling a little bit anxious, you're feeling a bit unhappy about a situation, great. Listen to that. When does that come up for you? When does it really come up for you? And then let's try to move away from those areas if we can. If you're getting anxiety because of work, well, let's have a look and let's examine work. Let's think about what you can do to put yourself back in charge. Take a bit of time off. Think about working in a different way. Maybe you need to change career. You know, all of these things are within our grasp, but let's take action.
It's a starting point, and that's exactly what people need to know, and how, like the how, right? Where do I start? I think that those are really great tips, Kevin. Thank you for that, and I think that would be useful for men, women, both, everyone, really.
I think also coming back to what we were saying earlier about talking. Of course, talking is there, you know, and you know, people listening to this, there are many services that are brilliant. Give them a try. Give all of these things a try because they are available. The point is, try something, and if that doesn't work, try something else. That's really key, and it's within the patients that I have who really thrive. It's the people who just keep going, even if it's something tiny.
Right. And I think that in the process of trying, even if it doesn't work, I think, because sometimes you might feel frustrated by the fact that it's not working, but what you could, like in terms of your thought process, say, okay, well, at least, you know, I've been taking ownership in trying to find a solution, and this is my path to solving this, and trying it out is a good way. So thanks for that, Kevin.
So all of those things, taking action into your body, all of those things, great. Also, I would say take acupuncture treatment. One patient of mine, a very young man, he'd been suspended from school. He'd had all sorts of, you know, anger issues. He had acupuncture treatment, very young guy, late teens, anger issues. He had a couple of treatments of acupuncture, and all of that anger just melted away, and his family just noticed such a huge difference. So you can do it you can actually take a shortcut by having a bit of acupuncture treatment.
I like that.
Oh, I think
that's
a really,
right? It's a good quote and statement.
Especially, and I think it concludes well our conversation, where sometimes it's like the verbal therapy versus the non-verbal therapy, and sometimes the verbal therapy looks too difficult, and if you want to have that shortcut to that, is the non-verbal therapy, and acupuncture can be one of them, and they'll bring you to open up and potentially speak and talk and open up on what's happening with you. So I think it's a great way to end our conversation. But before we end,
and on that note, let's do our rapid fire questions, which we are dying to know your answers to. So for the first one, what is the worst health advice you've ever received?
Okay, worst health advice I've ever received was I went along to my GP, who was an extremely overweight man. And I went along to him being about 11 stone, and he told me that I needed to lose weight. So that was the worst medical advice I've ever had in my life.
Right. Yeah, quite rich coming from him then.
And the second point is, if there was one habit we should all adopt, what would it be?
To explore and to do something that you love, whether that is reading, writing, kicking a ball, doesn't matter. Do something that you love and try to do it every day, or at least a couple of times a week.
And the last one is, if you were to put a song or a soundtrack to your life, what would it be?
Okay, I love Stevie Wonder, and I would put his song "A Time to Love," because it's all about making time for the important things in our lives and making time to spread love and to do things from a place of love.
That's really sweet. I like that a lot. Well, on this note, thank you so much, Kevin, for joining us today and sharing your wisdom and insight. I've definitely been learning through this conversation and have been reminded about a lot of mental health tips that I should be practicing myself. So thank you.
Well, thank you for having me. It's been an absolute pleasure. Thank you.
Thank you, Kevin. And hopefully with our conversation, we gave an option for men to deal with their mental health. So thank you so much.